Rise and grind, Guru Nation. Listen, I'm like Dr. Joe today. If you don't follow the Dr. Joe show, I co-produced that one with Daniel. I brought a book, Ayn Rand, The Virtue of Selfishness. It's really easy to read, but it's compact. It has concentrate. Like when you drink a juice, you got to like dilute it with water because this thing was written in the 1960s, but it applies to today. And one particular aspect from it that inspired this video or this podcast, if you're listening, is about networking. And really what it boils down to is human beings value in a social society, which FYI, we all exist in it. It's about gaining knowledge and about trade. And that's ultimately what networking is. So we're going to do this podcast on networking in the framework and in the context of expanding your knowledge base and expanding your capabilities to trade better. That's what it is at the end of the day. Everything else complicates things. But Daniel, roll the intro. Oh, and get the book. So more than just collecting business cards or asking people what you need help with, which is typical of most people when they think of networking, like, hey, here's my business card. Nobody ever is going to actually even keep it, right? Or if they do, they're going to put them in a drawer somewhere. What you want to do is occupy some of their mind somehow, which that can never be erased unless enough time has surpassed where other people have occupied their mind. So Ayn Rand, again, in that book, networking in a social structure, which we all exist, boils down to two fundamental values that you want to have and that you want to increase, and that's knowledge and trade. So she wrote about that in the book Virtue of Selfishness. Knowledge and trade are the two great values of social existence. In networking, these are the currencies we exchange. So let's see how that plays out in clinical research. Knowledge. Obviously, there's way too much knowledge in this industry for any of us. It would take us multiple lifetimes each to figure it all out. And then as soon as we did, which would never happen, but let's assume we did, the industry would shift. The industry changes again. Look what's going on right now with the National Institute of Health and the new administration. I mean, people are learning the hard way that change is inevitable. And I hope that those people in those situations where they got laid off unexpectedly become good at true networking. And again, it's knowledge and trade. And you cannot amass all the knowledge of our industry even in many lifetimes. If you're lucky, which I've suggested since the start of this YouTube channel back in 2010, you want to become a generalist over time. And what does that mean? That means somebody who can trade many different things. So we live in a society, capitalism, where it's a specialization of skills, which you then trade in exchange for another skill from someone else. And we use money as an intermediary so that you don't have to worry about, well, if I exchange my knowledge and I want some bread, how do we divide that up cleanly? This is why we have money and currency. But really what networking boils down to, again, it's two fundamental things. It's knowledge and trade. Everyone has some knowledge and everyone has some type of skill set they can trade. Even if you have no experience in clinical research, you still have something. Look at Daniel, who's our videographer here. He has no experience in clinical research. But if he wanted to leverage his skill set, which is setting up podcasts and doing marketing for sites, and for sponsors, which he's already done. He's worked with Creo, with Anato, with Viva already, as well as other sites like my own Yuma Clinical Trials, Sun Valley Research Center. And he really wanted to get into research. He can leverage that expertise. Again, no experience in research, but he has a skill set that he can trade with someone else in exchange for a career, the beginning of a new career, if he wanted to. And if you have experience in this space, you have even more opportunities because you have more knowledge, and then you have even more things that you can trade. So when you go to a conference, when you go to a networking event, and I wanted to quickly give a shout out to a couple of groups that you want to get to know. So first of all, Save Our Sites. I don't care when you're watching this in the future, Save Our Sites is going to have some event. We have a live streams, we have regional meetups, we have big conferences. You want to get involved with Save Our Sites, so just go to saveoursites.com. Same thing with the other group I'm a co-founder of, Latinos in Clinical Research. We have monthly meetings where we have guests come on and share their knowledge and their potential to share trade with you, the viewer. You go from a passive observer to an active participant in the knowledge exchange and in potentially the trade exchange that happens when you are on a webinar or in person. I think it's more obvious because people are physically there, but you can also do this virtually. At the end of the day, it's just knowledge exchange and trading of skill sets. And all businesses need more of both of those. You need more knowledge. You can't possibly figure out everything in this industry, and most companies are looking to grow. Most individuals are looking to grow. You don't want stagnation. If you're okay with stagnating your career, you don't need networking. And Ayn Rand actually talks about that as well in another chapter. There's a problem with people that get complacent and that don't want to improve their skill sets and don't want to do the things like networking because they become at the mercy of layoffs. And there are people who've been laid off that were not having the stagnation spirit. I mean, in this recent round of NIH layoffs, they like plenty of good, non-stagnating people, growth mindset people got laid off. But I think those people can bounce back fairly quickly because they have, again, knowledge and trade. They have skills they can actually trade in the marketplace. But if you're somebody that doesn't want to network, you have a stagnation mindset, and that's not going to get you very far because technology comes up. Forget the Trump administration. What happens when global outsourcing gets rid of the job that you're doing right now? Like what happened to a lot of study startup specialists with the rise of Latin America, same time zone, 1/5 of the cost for those employees, just as educated, perfect English. You have a bunch of study startup specialists in the United States. It's unfortunate, lost their roles, but if they've been doing their job of networking, which is increasing their knowledge and figuring out ways to trade their skill sets, they're going to be okay. Because growth, when things like global outsourcing or artificial intelligence come in and disrupt certain roles and certain industries, and for sure certain industries get disrupted more than others, clinical research is generally not one of those industries that gets radically disrupted. And I think this is why the recent layoffs at the NIH have shaken people to their core. First of all, it's something that's never happened before, like on this scale. People got complacent in those jobs. People got stagnant in their growth. And yeah, they were important roles, but the cliche about government jobs is it's safe, it's cozy. The agreement is you kind of take less pay, but less is expected of you. And again, not everyone. There was people there that were, there's plenty of need for what the NIH was doing. I have personal concerns about what's going to happen with rare and orphan diseases. I don't think it was a good idea for patients to be cut off of studies for life-altering treatments or life-altering research treatments. Even though they're not considered treatments, there are plenty of cancer patients, children, that were paused in their studies. I hope there's some kind of contingency for them. But as far as the workers are concerned, I mean, you have to do a good job of networking. So Latinos in Clinical Research, Save Our Sites, Elizabeth Tabor, who's a Save Our Sites ally, she has what's called the Clinical Research Referral Club, and they share in the spirit of networking. And there's others. We just interviewed yesterday on one of our Save Our Sites roundtable, the Clinical Research Justice League. They've been around for a while, but the Clinical Research Justice League is back now, and they specialize in networking via volunteer opportunities. And there are site owners that are involved, there are consultants that are involved, there are CRAs that are involved. This is an opportunity for you, even if you have a job that you're doing well at and you think you're in a safe space. If you want to expand your opportunities, you want to maybe sign up for some volunteer work. It's going to help you in the long run because you're going to further expand your knowledge base, and you're going to meet people who eventually will be in positions where they need to barter and trade with you. And hopefully you come front of mind because, like I said, unlike a business card, being in someone's head when they think of a problem is the ultimate outcome for networking. So, knowledge exchange. According to Ayn Rand, the value of knowledge is in its exchange and expansion. Networking allows you to learn from others' experience, share your insights, and collectively grow. So, for example, I actually learned from my interactions with Robert Goldman about new regulatory pathways. If it wasn't for my involvement with him, by the way, I didn't receive payments for doing these works. I was just on Zoom calls and bid defenses with him and my business partner, Chris, on a CRO startup that we're still working on. But we've done tons of bid defenses. We've actually gone pretty far down the road. So I've seen enough proposals, bid defenses to understand the different regulatory pathways that different investigational products take. I know if it's one that involves a gene therapy, it's a very different pathway and a different department than a generic or a biologic or a device. And we've actually done all of those, and I didn't get any money off of those so far. The goal is eventually you're going to get paid for it, but initially you do it for what? For the experience. And what does that experience give you? It actually gives you knowledge, and it lets you learn from others' experience who are professionals in that niche, so that one day you can get enough knowledge to where you can leverage your knowledge into trading with others. So networking isn't just about receiving, it's about giving and collaborating. This is why when a startup, maybe a startup company that has no funding, asks me to jump on a Zoom, hey, let me pick your brain, even though I hate that term, I'll call up Robert and Chris if I feel like it's a potential CRO project and say, hey, let's get on this. We've even done spec work for people, meaning we've done the CRO work just for the sake of experience. We're doing this with Patient ACE for a few sponsors right now. My patient recruitment company that we use at Yuma Clinical Trials. We're trying to get sponsors to utilize Patient ACE as the central recruitment vendor. And we're doing it at cost, meaning spec work. The reason we do that is we realize we have to give in order to receive as well. And there's other examples of Patient ACE doing surveys it was previously for the National Institute of Health. I don't think that budget has been affected because it's been an existing one, but who knows. But again, it's more charity work, and not in the sense of charity for like the sake of altruism. Because ultimately, like Ayn Rand said, there's a virtue in selfishness. You do it because at some point you're going to expand your skill set, and it's going to let you reciprocate into receiving as well. Because if you expand your knowledge base, that you're going to be in demand for whatever service you have. And this is how we're getting into patient recruitment and things like that. So if you are somebody doing well, consider giving back. And again, not just for the sake of altruism, although there's nothing wrong with that, but there's also nothing wrong in getting your name out there, getting your branding, your personal branding out there. And in exchange of you giving your knowledge and expertise as volunteering, you will receive things in return too, other people's knowledge and expertise, because we don't live in silos. We don't live on deserted islands. There's also co-authors on white papers, partnering with other sites. Look at Save Our Sites. Save Our Sites is the first year we did it, we broke even. The second year we're going to do it. We may make a little bit of money, but there was a while where we might have lost money. And I think at worst we'll break even this year again. But we're not doing it necessarily for that. We're doing it to improve the outcomes for sites. And in return, and not because we're Mother Teresa, in return we are getting brand awareness for ourselves and our own sites. We're getting solutions for our own sites. We're getting increased opportunities for our own sites because we are creating the networking environment that is needed. And it's not done precisely to make money. It's done to give and to receive, which is true networking at its finest. Finding mentors and learning from experienced professionals can accelerate your career growth, but you gotta remind yourself, if you're somebody seeking a mentor, a lot of people are going after the same mentors. You have to put yourself in their shoes and what they need. So again, you got to go internal here and say, what do I know? And what is my trade? So I can, and how does that work for this person? If I'm asking them to be my mentor, which is not a simple ask, by the way, what am I actually going to give them in exchange? Even if no money is being exchanged, time is being exchanged, which is more valuable than money. And ideally, skill sets and knowledge are being exchanged. And the mentor has to have the time for it. So you like the high profile mentors, they're probably not a good idea, but this is why things like Save Our Sites is important. This is why webinars like Latinos in Clinical Research are important. This is why Clinical Research Referral Club, Clinical Research Justice League are important, because you're going to meet the characters that are not as high profile as someone like myself or a Brad, who will actually have time. And if they're watching or listening to this podcast, they're going to want to start seeking out people to mentor. Because one thing I've learned about my CRA Academy and the CRC Academy, and pretty soon starting to do things through the University of Clinical Research, the students we put in the industry, every now and then they give back something to us. The same thing with my consulting company with Chris. And we didn't do it for this. We did it because it was our job to help them out. We had a site owner who we helped get studies, build their site. This person eventually sold their site and went to go work at a sponsor. And they came back to us with a project for the sponsor. Now, that's an unintended consequence, and in a way, it's networking. And that's something we could have actually done for free for them. And we're considering doing spec work for them. So you got to think of ways that you're not dealing with just high-profile people if you're seeking mentors. So myself and Chris have done this for the academy students and for clients that wanted to start sites and run their sites. There's a strategy to networking. Obviously, attend industry events, but money and time, your resources are not infinite. So you got to pick and choose wisely. This is why I believe with Save Our Sites, it's not just that it's a low cost conference, because that still doesn't reduce friction. The friction is you still got to hop on a plane, go to Oklahoma City, get a hotel, take 2 or 3 days off of work. We're going to come out with regional meetups where we're going to try to hit up different markets throughout the country and eventually throughout the world where you don't have to take time off of work. We're going to do it in your neighborhood. We just did one in San Diego. We had people come down from LA, from San Diego, from Arizona to be there. They didn't have to take time off of work. They didn't have to get on an airplane. They just showed up, and oh, by the way, it was free. So attending conferences, obviously a good thing, but like I said, joining these webinars is also good, and that's as frictionless as it comes. But instead of being a passive observer, if you see or hear something interesting, become engaged with a community. Nothing makes a webinar host's day more than receiving a comment, even a simple comment, one that you may not think is good. Even if you have nothing to add to the conversation, just something encouraging. If you do that over and over and over again, you're starting to brand yourself. And then occasionally maybe you do have something to contribute knowledge-wise. And again, now you're getting into the realms of knowledge exchange and trading, right? And that's, at the end of the day, we are in a social environment. Capitalism is a team sport. It's individual and it's team sport. It's individual in the sense that you are doing this for yourself, but you are doing it in collaboration with other people. And then be prepared for your elevator pitch. Share your expertise concisely. I think Steve Jobs said it best. I don't know the exact quote, but he said, make the complex simple. So distill your elevator pitch down to like a sentence. Just like Ayn Rand did it, actually. She inspired me, even though she's gone now for many years, many decades. She inspired me to do this video, this podcast, because she basically broke down what networking means. It means knowledge expansion and trading skill sets. Like, that's pretty concise. So develop your elevator pitch and tailor it to your audience. So whether it's a sponsor, CRO, a fellow site owner, fellow employee, I think we're going to enter an era of consultants. I think a good amount of the people that have been victims of these layoffs, I think a good amount of them, everyone's scared right now. 10 years from now, I think a pretty significant percentage are going to look back and say, that was the best thing that happened to me because it forced me to go out on my own. And now I'm a consultant and now I'm making way more and having way more fun. And I do things at my pace. And yes, I had to increase my skill sets and knowledge and I had to learn how to network. But I think it's going to be good for many people. And if you're one of the people that have been impacted, it could get really good. Now, beyond the initial connection is networking the relationships. So networking doesn't end after the first meeting. One of my slogans from way back in the day on this channel is follow up, follow up, follow up. So consistent communication, not just sending personalized follow up emails, but extending the relationship somehow. Hey, it was really nice to meet you. Are you going to be on any webinars? Are you going to any regional meetups? If you're local, hey, maybe we can get lunch. Maybe I can take you to get coffee. I would love to come see your site, or whatever the relationship is. Figure out how to extend and follow up and have consistent communication. And remember, no one likes to just give. You got to learn how to be a resource to other people too. So offer your support and expertise to others. Networking is a two-way street. Everyone has something to offer. Even if you have no experience, I showed you that using the videographer here that you'll see at SOS as an example. sharing relevant industry articles, or introducing connections who can benefit from knowing each other. This part, not enough people do. Connecting other people. I started doing this by accident, mainly because a lot of people once I started the YouTube channel, a lot of people started reaching out to me and asking for help. And I'm a human being and my bandwidth is limited. So I started looking to other people that I can connect people with. And that's called a mensch. I learned this phrase. It's a Hebrew phrase, but being a mensch, Yiddish, being a mensch is being a connector. And you can do really good networking and you can really develop a brand for yourself by connecting people to each other. Someone else who does a really good job of this is Monica Quitiva, one of my Latinos in Clinical Research and Save Our Sites co-founders. She's also a site owner. She does a very good job of connecting people. And there are a lot of people in this space that are really good at talking to someone, figuring out their problem, and then remembering another conversation they had with someone else or someone else they met and connecting those two people together and then removing themselves from the conversation. Not wanting anything in return, but they are getting something in return. They're building a brand for themselves and they're building a reputation that they are somebody that you want to be involved with. What you want to avoid is building a reputation of you being someone that people should avoid. And there are plenty of people, and some of them successful, that have built a reputation for people as someone that people should avoid. And that's unfortunate. And build authentic relationships. People do business with those they trust. Don't try to cut corners. Don't try to screw people over. Build authentic, long-lasting relationships. If you're not going to try to do that with someone, don't even bother. It's not going to work because the long-term impact of this stuff is real. Networking can open doors for career advancements. It can open doors to new opportunities, new leadership roles. It can give you new streams of revenue. It helps you make a lasting impact in the field, and it's going to help you increase your knowledge base and develop more skills that you can then leverage into trade. For example, through my own network, I've been able to grow my site, Yuma Clinical Trials, into a flagship site because of the networking. One of the first studies I got that was significant was from somebody who watched the YouTube videos. The first few studies I got, they were not good studies, and they were just standard way you get studies. Network with CROs, submit feasibilities. You eventually get some studies. But the first significant study we received where we got significant revenue that allowed us to grow and build the foundation was from somebody who was a study director. He was a fan of the show. I didn't really know him, but he reached out and said, "Hey man, I need rescue sites, and I know you're reputable. You don't know me, but I've been watching and listening. And could you do this? And be honest with me if you can't." And it was something we could do, and I knew we could do it. And we did it. We did a good job. We didn't let him down. And that's an example of building a lasting relationship, because now this person and I have gotten a lot closer, and there's all kinds of other opportunities we can work on together. So not everyone's going to have a YouTube channel, but you want to build the brand. The YouTube channel for me helped me build my brand, but your brand might be connecting people. Your brand might be commenting on webinars. Your brand might be reaching out to people at conferences, or look at people like Jess Thompson who go out of their way to volunteer for conferences like SOS. They're the ones who do the Fort Kindness. They bring their own candies to Fort Kindness. They bring snacks. Nobody pays them to do that. They do it themselves. They're putting themselves out there to develop and cultivate an atmosphere that they want to be a part of. And as a default, other people want to be a part of, and now other people gravitate towards them. And now Jess has her own business, Clinical Research Project Management Academy, I believe. Everyone get in touch with Jess Thompson. She's someone that's could have just as easily made this podcast as myself. Ultimately, networking isn't about what you can get. It's about how you can grow and how you can help others grow. And that's the real value of it. So networking in clinical research is about knowledge and trade. I really want to drive that home, distill it into those two things, knowledge expansion and trade expansion. Just as Ayn Rand emphasized in the book, The Virtue of Selfishness, which I recommend everybody get. You don't have to agree with her ideology. You can skip chapters if you don't like it. She's very pro-capitalism, by the way, very anti-collectivism. But you don't have to agree with everything that she wrote to understand, hey, this is a golden nugget here. Distilled networking to two things, knowledge and trade. And it's about learning, sharing, and growing together. I don't think anyone can disagree with that. So if you found this video or podcast valuable, share it with other people. Maybe this could be your first thing that you do to help someone out. Share this with someone. And then don't forget to like, subscribe, comment, share. Let me know if I missed anything. And let me know in the comments if you've implemented any of these things in your career. Like, subscribe, comment, share. Thank you for watching and listening. Catch you guys later. Bye-bye. Hey, if you guys like that kind of content, make sure you like, subscribe, comment, share. Stay tuned for more videos.